Scrubs. We're 13 minutes late.
Let's go.
Hello and welcome to the Demand Better podcast. Shout out to Faraz, who's been on here. Faraz Javed in Detroit. He sent me this. Didn't send one to Corona. That's okay. Once we say that, now Faraz is the kind of guy who is going to get guilted and send you something. So expect that. But I'm not going to tell him we did this. And if he watches, he'll know. But I'm a lifelong Jets fan. I'll never change, even though it's been miserable. We got some hope this year. I know he's got the Bills over here next to me, to my right. And it looks like the left here. But how do you feel about that near the Buffalo Bills draft?
Listen, man, we don't know anything. You don't know anything. They don't know anything. We'll find out. Welcome back to the Demand Better podcast, your one-stop shop of navigating the crazy world of fitness, and wellness. This episode is brought to you by our awesome sponsor, Fit Care Physiotherapy and Wellness, where the emphasis is to focus on your fitness so you can avoid the healthcare space. Just like Fit Care, we're all about taking charge of our health and feeling our absolute best. I'm your host, Corona, broadcasting live from the concrete jungle of New York City, and joining from the beautiful mountains of Erie, Colorado, is the one and only Dr. Bo Babenko. Bo, what's good?
What's up? We're not in the mountains, but we're pretty close. We're pretty close. I
try to move in there, make it nice.
I appreciate it. Yeah, we're right by the mountains. We got some great views. The weather's finally lightening up a little bit. It's been interesting. Yeah, overall doing great here. Doing great. Let's talk some passive modalities.
Before you say, how's the baby? How's baby and Maha? We gotta make sure.
He's a toddler. He's not a baby. Don't call him a baby. He's a toddler.
Okay, I'm sorry. The toddler. I was getting the jersey on. And Maha, what's up?
Yeah.
All right. Today, we're diving into the world of passive modalities. Those treatments that help your body chill and get back into alignment. And we're talking like massage, chiropractic care, yoga, even fancy Theragun you keep seeing online. But before we jump in, let's address the elephant in the room. Why do we keep going back for these treatments, Bo, only to find ourselves needing them again?
Because they work. They work. If you have a headache and you take a pill and it makes your headache go away, or at least temporarily provides relief, it works. It's easy. That's it. That's all I got. We've both been doing this a very long time combined. What do we say we have? 50, 60 years combined?
Yeah, 50 is a long time.
Corona's got 55 of those years. I've only got 5. No, that's a joke. That's a joke. But yeah, we've been doing this a long time, and I think we've seen these situations time and time again. That's the New York City soundtrack behind you there. You got the fire engine in the back. Anyway,
it's my theme music everywhere I go.
So yes, passive modalities, they feel good. It's a common thing. I'm over here trying to sell, and I think we both are trying to sell the exact opposite of passive modalities for the most part. I offer passive modalities within my practice. Someone comes to me, they want some pain relief. I have dry needling that I can do here in Colorado. Physical therapist, fun little fact, cannot do that in New York, where I did practice, or California, two of the bigger states. It's all political nonsense, packed money and lobbying and all that stuff. Acupuncture is literally saw it as a threat, so they have more money in New York and California. Physical therapists weren't throwing that much money behind this concept of allowing us to do dry needling. Colorado's been having this for a long time, though. And yeah, since I moved to Colorado, got certified right away. I do find it very useful in that scope. We can do some other episodes specifically about dry needling. But other big picture we're going to focus on today is, again, chiropractic. You go in, your back hurts, they do a little pop, you get off the table, you're like, oh, this feels pretty good. My back pain went away. Something magical there. It's a good feeling. How long does that last? A, that's a big piece of that conversation.
Yes.
B is how many times is it going to come back? That's the problem that I see. And the other problem I see, and I think it's easy to ignore, is it's easy to kick the can down the road, as the analogy goes. And what I see oftentimes is somebody who's finally had that 9 out of 10, 10 out of 10 level of back pain that sent them maybe to the emergency room or urgent care. And if you look back at the history, they've been kicking this can down the road. It's not one little thing. And it's a difficult conversation to have. I don't know, by the way, have you seen any of the whole buzz of Andrew Huberman, the Huberman Lab podcast, talking about low back pain? Did you see any of this?
Yeah. We discussed this offline the other day. You and I discussed this. And I did.
Well, he just put it out, and now all the physical therapy people are yelling and screaming, and I might jump into that little fray. I don't want to fully defend him, but I'm going to say it here that like I think people who are yelling at him didn't really listen to the episode, because he's not saying anything egregious. He's not saying this is the one thing that'll fix you. And I think it's a useful resource, and I think ultimately the more useful stuff we can put out there, which is our goal here, right? We're trying to be a consumer's guide to the fitness and healthcare space. So in terms of useful guides, let's come back to passive modalities.
Yeah, no, but listen, when you're talking about an Andrew Huberman, and you talk about a guy who wants you to put on ankle weights for cure your back pain forever, that we talked about. Remember the guy that has his he has his
knees over toes guy. That's knees over toes guy. It's a little different.
No. The guy that Chris Colucci told us, who told you to put on ankle weights and walk around. Yes, and he has hundreds of thousands of followers. But when we get back to passive modalities, there's a use for passive modalities. There's not a question that passive modalities, there is a place for them. Where my issue is with the passive modalities is something very, very basic. It's an annuity for a lot of people because there's a lot of ways you can make adjustments that those passive modalities will even have more of an impact in your life. If you start activating certain muscles that aren't activated, and you start getting yourself out of this pain. Massage is the greatest example of all of these. When we sit back and you see, I got a massage every Friday. Well, why do you need that massage every Friday? What are you changing? After that massage gets you back to allegedly neutral, or your new neutral, you continue doing the same habits, the same things, the same body posturings, and that brings you right back to where you started. What you and I are trying to do is basically, hey, okay, we can tell you what muscles aren't firing. We can tell you how to adjust certain things. When we can make that massage be more effective and more impactful in your life than it would be if you continue just doing it every week. And I think it's easier, and we just discussed this, to do a massage, because you just got to lay there, than to do the work.
Yeah, that's it. And again, that's what I was trying to bring up, the Andrew Huberman thing. I think people get a little, again, the information I think he provided is very solid. I think he's trying to improve that conversation better than anything that's really out there. It's a complicated conversation. When we talk about back pain, let's say, which is one of the most common things, that's the episode he did that we're referencing here. Yeah, again, it's nuanced. It comes down to, how is the practitioner, the physical therapist, or whoever's in front of you, how are we engaging with you, the patient, or the person in pain? So it becomes nuanced, and then it's saying, hey, I've seen this 300 times in the last month. Here's my exercise you got to do. Like, it's up to you to do that. That's not as fun of a sell as like, lay down, let me stretch you out. We might get a little pop. Again, another thing I always want to bust that myth is that physical therapists can do the same thing that chiropractors do. Everyone's always kind of surprised by this. They call it an adjustment. We call it a high velocity, low amplitude thrust. We have a marketing problem, people. But you get that pop. It's the same technique. We have different grades of it. I would say we're doing more of the research, all that kind of stuff. So bottom line being, again, passive modalities are difficult because not just that it's hard to get people to do exercise and be active. So the opposite of passive modalities is active modalities. What's up, Anthony Maritato? He just posted about he's a PT I just had on, if you hadn't seen that episode. And he just posted about the Huberman thing. I wanted to message you, Mr. Tony Maritato, talk about that. Anyway, but point being that, again, what's the opposite of passive modalities, where, again, you're laying down, someone's doing something to you, acupuncture, massage, chiropractic. The opposite of that is active modalities, and it doesn't have to be modalities, but just being active, right? Generating a fitness. That's the business, again, fit care. Fitness, focus on your fitness. How do we define fitness? That's the other part of that conversation. What is Corona's main thing is fitness. Personal training is fitness. So we're trying to improve your fitness. I come back to the model, and I meant to have this queued up, but I'll just do it here, right? Yep. So on one end of the spectrum, you have disability, disease, injury. In the center, we have wellness. And then all the way over here on the opposite end of disease is fitness. So the fittest person on earth, all the way over here. The person who's most disabled, or when you're injured, you're all the way on the other end of the spectrum. Where do you fall right now on that spectrum, right? I'm feeling pretty good. I'm nowhere near the fittest on earth or whatever, but, I'm definitely ahead of wellness. And the simple concept that we always analogize this to, right, is the putting more money in your bank account. So that's the fitness. But how do we define fitness is always a little trickier. I'm going to throw it back to you. Otherwise, I can keep rambling.
Let's back up. Let's because there's going to be people that are coming onto this and they're going to be a little confused. So let's define passive modality and the use of it. Well, I think you gave a little bit. You're laying down, they're doing work on you, blah, blah, blah. Active modality, more like a yoga. Let's have you define passive modality first and how it flows into chronic disease, which is the problem that we are having.
Yeah, so the modalities is the other funny thing too, to make sure we define is just what are we using in this situation? You come to me with back pain. Here are my weapons of choice, right? I can turn around and grab needles. I can turn around and grab a goniometer to measure your range of motion. I can use my hands, right? So that's the modality is the choice that we're making. What tool are we going to use? Passive meaning, again, the person who is receiving the thing, it has to do nothing with it, right? There's something called active release technique if you have some pain in your trap here. So, I might poke on there. That's me being, that's a passive modality. If I'm just massaging it, but then I ask you to actually move your arm with it as I'm poking, that's a little more active release technique. The research has not supported that being very useful long-term, but it still has its place somewhere. But yes, passive meaning, again, the person receiving the treatment is not doing anything. Again, the other version of active would be, okay, you have shoulder pain. Let's grab a yellow rubber band and do these exercises, which isn't necessarily the thing that's going to fix you either. But that's where it becomes a little more nuanced of a conversation is we now need to have progressions. And again, you want to go back to doing CrossFit. God forbid. I know Corona hates CrossFit, but you want to go do kipping pull-ups or butterfly and pull-ups or muscle-ups or what have you. Doing yellow rubber bands and even getting all the way up to black rubber bands, which is usually the heaviest rubber band, TheraBand. You're doing active things, but there's still a huge gap of how we're going to get you from doing the rubber band thing and whatever you can do in your clinic, right, to go all the way into the gym and do that next thing. Or you're a power lifter and you want to deadlift 500 pounds. To go from doing it in a little gym, the insurance-based model, most insurance-based physical therapy clinics that I've seen, having done this a long time, I'll be surprised if they have anything more than a 40-pound weight, which is it's pretty light. And then to go from that to 500 pounds, there's a pretty big gap there. And there are people who specialize in this. And again, I'm going off on a different tangent here, but active. Yeah.
Go ahead. Finish your thought. I'm sorry to interrupt.
Well, no, I was going to veer us back to active. What does active mean?
Okay, no. I just kind of want you just brought something that I think is very, very interesting here, and I think most people don't want to do the work. There's easy solutions to curing our ails, and people will take normally it's just like our bodies. We'll take the easiest route to get from point A to point B. People don't want to do the work, Bo. People don't want to do the hard work to get there. And if you do the hard work to get there a lot when you deal with these passive modalities, right? Those passive modalities have a longer lasting effect as your body gets more in tune with itself and firing appropriately. You were going to say.
Yeah, just to go off of that, again, I don't want to completely overgeneralize. And I think this is the thing where, again, a guy like Huberman does a pretty good job of avoiding generalizing people that way you just did. And I'm gonna point my finger at you.
Go ahead.
But yeah, but I agree. It's easy to say people don't want to do the work, but I also think that's part of a defunct system. There is no, the work is what? Go see a personal trainer like Corona, who knows what he's doing, pay him this much money and develop a plan that now that's the work, right? Like that. And I think they're just, people don't know what the work is. If we're saying, it's easy for us to say because we know what we think the work is. And if we have someone in front of us with back pain or chronic back pain or whatever. So I just want to take a big step back again. And this is what I heard in the Huberman thing that I think is going to cause a lot of this controversy and things like that. Like I said, Tony, we gotta talk, Tony. I'm looking forward to talk or hearing Tony. Tony does a morning coffee thing with two other physical therapists. They do it once a week or twice a week, and it's fun. It's a fun listen, and another again game changer in the space. Go check out my episode with him on Bono's Health. Anyway, so that's the part where I want to make sure we're giving people the benefit of the doubt. And again, what does the system look like? Like again, for us, it's easy to say people are lazy; they don't want to do the work. I think it's just people are confused, and that's something we've talked about on many episodes, right? There's a lot of confusion out there. That's why people do say, oh, this guy's selling whatever ankle weights that our other guest Chris Colucci talked about, and like, why does he have 900,000 followers? Because he's selling like, this is the thing that works, and like, he's like, I know what works, look at me, I'm jacked. And we're not going to talk about how many performance enhancing drugs are involved, but the point being that I think we have to give everyone a little grace, and it's definitely easier. And this is why it's an interesting topic. And I want to make sure we cover this whole topic of passive modalities, understanding what it is. If somebody's in back pain and they've had episodes of back pain, and they're like, every time I go to the physical therapist or the chiropractor or whatever, or the acupuncturist, it feels better. And I love this acupuncturist, and I'm not picking on any one profession for any particular reason, but I love this acupuncturist over here in Boulder. And every time I have back pain, and I have back pain, how often do you have back pain episodes, miss? Well, it was every 3 years. Now it's every year. Now it's every 6 months. Now it's every month. And that's the common way back pain behaves, specifically talking about back pain. And that's the part where it's like, again, if you can keep taking Tylenol, it's good to have it in your house. Like, I'm not against having Tylenol in my house. If my child has a headache, or he's screaming, or he's a toothache, or whatever, like, we have these magical medicines that we can give to a human and make him feel better. Go ahead.
But you're not going to give your kid Tylenol for 12 days. I mean, right. This is where we are. I mean, it's maddening to me, man. It's maddening to me. There's muscles that are, to me, it's a very simple game in a lot of situations. There's muscles that are overfired. There's muscles that aren't fired. There's position. We have to look at your lifestyle. We have to create a plan, and we have to do the hard work to get there from point A to point B, get something activated so you can go from point A to point B in a lot of situations.
But what you just said, what you just said in that like 10-second snippet, which I love, again, I know what it means, but I don't think the general consumer is going to be able to take what you just said and rattled off, and you rattled it so fast. And again, I know why you did it, but I'm going to, again, call you out on saying, like, what does that really mean? And I think that's the solution. That's the piece where, okay, what's the opposite? And we were talking before we went live of like, what do we want to give people at the end of this? I think it's exactly that little 10-second snippet that you rattled off. And again, it's just so natural. Yeah, However, unless they're in front of you,
have to bring it.
We have to and so this is the part where another friend of mine, and in fact, Tony, who was watching on LinkedIn, one of his other co-hosts, there's Dave Kittle, who's a concierge pain relief guy in New York City, which I need to connect you guys, actually. I keep forgetting that. And then there's Jimmy McKay, and what he did for a while, he has a great brand and podcast called the PT Pintcast, talking about having the best conversations over a pint. Yeah. He's jumped on here as well before of commenting. So, but he for a little while, he was working for Mount Sinai in New York City, not too far from where Mr. David Corona is, as a science communicator. That was his role. And that's the take. Okay, we're doing all this cool research, and we need to synthesize it to the public. And again, not to bring up super controversial stuff, but we talk about the COVID vaccine. That, again, if you're listening to this might either trigger you to turn this off, trigger you to get upset, trigger you to get whatever. And I apologize for that, because it's that's just what it is, right? But the point being that there was poor science communication of saying, this is what we understand in layman's terms, not, well, there's 17 randomized control trials and there's a meta-analysis showing this, and we've done placebo-controlled, and like throwing all these words out there. And I'm not saying you did that just now, but I would love for you to take what you just said and not only synthesize what you just said, because that is, to me, I hear it and I'm like, that's great. But how do we get, my grandmother in Florida? I don't have a grandmother in Florida. All my grandparents are passed away. But how do we get my friend who's 70-year-old mother who's in Florida? This is a real case. 70-year-old mother who needs to get more fit. She's having knee pain. She's having trouble doing things, getting up and down stairs, tripping down her driveway. How do we get her exactly what you just said on a mass scale? That's the hard part. So I don't know if you have any answers.
No, I don't know if I have any answers that I can't put my hands on you and look at you individually and try to figure out the plan for you as what you have. But the reality is our bodies replicate movement. You are what you repeatedly do. And as you just went through a couple seconds ago, where it was, when do you have back pain? I have it every year. When do you have back pain? Oh man, it's every 8 months. When do you have back pain? Every 6 months. When do you have back pain? Every 4. And in that, from that, just that small snippet that we're discussing, there's been no change. There's been no, I'm going to the gym, I'm rounded, my shoulders hurt. I found my back pain is on the belt line. It's my hip flexor psoas. I'm not strengthening my glutes. You have to go through someone who can actually give you the information, because you repeatedly are going to continue doing the same thing over and over and over and over again. And that's what you and I see every single day. Well, so when we're dealing with these people, like, and I said it, I'll say it slow. I said, I activate the muscles that are underactive. If you sit on your butt a lot, your glutes don't fire. Your glutes don't work appropriately. So you have to activate them outside of sitting on them, because sitting on them is not work. So it's a continuum. It's all freaking connected. And it's not just that area. You're going to obviously have to open up your chest. And there's other muscles you have to activate in that process. And I think the difficult message is that this isn't just an easy one-size-fits-all fix. It's just not. You have to analyze each individual person, and these modalities do help. My issue with the modalities isn't the modalities themselves. You have to do something outside the modality to progress forward to get through the pain. We heal ourselves, Bo, and you know this. If you do the right things and you identify what the issues, we can literally heal ourselves and not be in the medical office. And that's not the message that's being portrayed out there, not even slightly. And you know as well as I do, people are getting inundated by bad information. That it's easy. You could just do it online. I could do it online. It's not that easy. I'm sorry. It's just not that easy. Maybe I'm being biased from being in this industry for so long. I think there are very few people, and I've said this many times on many podcasts, very few people who can do online training like you do, Bo. Very few. And there's a lot of people out there making money, and in my mind, hurting people. So when we get to the nuts and bolts of this, there is an issue with the way your body functions, and we have to figure out what's over functioning or what's overactive, and decrease that, and increase what's underactive, and make you understand that. My clients understand what I'm talking about because we're together all the time. That's why. And I want people to go out into the world, and if you're looking for a practitioner, yay, I got back pain, put on ankle weights. You'll be just fine. No, just absolutely not.
Yeah. Just wanted to make sure you were clear on the fact that was not the the
thing. Yeah. Okay. I just think, we're passionate about this, and I really want people to understand. I use the Theragun. We talked about this. We use the boots. We use the Theragun. We use the modalities. We also do a bunch of other stuff outside of that, so we stay fit and limber, and be able to do whatever we need to do.
Right, and that's the part too where I think the conversation has to change. I think that's the part we really want to get to the listener here today is the passive modality. I think we've defined it well enough, right? Hopefully, and should be relatively explanatory at this point. The part that people are missing is the movement practice. So again, if you have shoulder, like my trap's really hurting, I woke up with a pinched nerve. Again, another real life example going on right now. A friend of mine's had some neck pain. He's in California. I was trying to help him remotely. I said, hey, you know what? It sounds like you're going to do better going to see somebody in person. Maybe they can start moving you in the right direction. I'm happy to keep consulting and making sure we're moving you in the right direction. He gave him a bunch of exercises as well, that clinician. And I checked in on him today. He's like, yeah, it helped a little bit what he did in person. But like, I realized he gave me like 10 different exercises, which might be too many. I don't know. That's a whole nother conversation. Yeah. But he's like, yeah, I know I got to get to work, but he's like, I'm busy. He's got a job. He's doing all these other things. He's not prioritizing the exercises, which I'm not calling him out here if he's watching. I'm not calling you out, but it's hard. So it's understanding, having that conversation, have that connection. The modality isn't the thing. It's not cracking your back. It's not needles. It's not whatever. All of those modalities, by the way, guys, it's easy to see how they make you feel better. That episode or the period, the effect of the feeling better should be the wake-up call. And this is another thing I'm always and I hate to, bring this to death, but every time there's a funeral, everybody's like, man, we should really take advantage and do more gratitude and connect with our loved ones and be like, let me check in with Corona. I haven't talked to him in a month, and like, let me see what's, versus someone passes away and then you're like, I really wish I had spoken to them more. So those regrets, those kind of things, we get caught up in life. It's busy. It's understanding how to prioritize these things. I didn't mean to get so existential and philosophical on this whole thing, but again, what the takeaway I want people to come back to try to bring it back a little bit is there needs to be a movement practice. And again, even if somebody's running and they just want to keep running and they're happy running, and like that's the thing they want to do, we can have that conversation. But like, okay, if you want to keep running for the next 30 years, 50 years, the rest of your life, let's talk about what things will help you run, which I think is missing. A lot of times runners are just like, I'm going to run. Like maybe there's some like, yeah, if I deadlift a little here, if I do some yoga here, like I feel a little better. It allows me to run more, especially as I get older. It's just an incomplete picture. The same way if you go to your doctor, you get blood work, they're like, hey, I don't like your cholesterol levels, your vitamin D levels a little low, your iron's a little high, whatever the things are. They're like, we need to change how you're eating or take this medication, take the supplement. So this comes back to medicine 2.0 versus medicine 3.0. And we've talked about this. Do you remember this whole thing?
Yeah.
Medicine 2.0 versus 3.0. Do you want to break it down for the people, or shall I?
I don't, because I don't know it enough to break it down fully, but I remember the conversation for sure.
So medicine 2.0 is kind of the model we're currently living in. You think of your medical doctor, you think of the emergency department. If you were to hurt yourself, you're going to medicine 2.0, you're in a car accident. It's, okay, this person's lung is collapsing. We can put the lung back. We can make sure their heart is still pumping and there's air, oxygen going in, carbon dioxide coming out, like basic life function. Medicine 2.0. Again, you have a higher risk of heart disease or a cardiac event because your cholesterol is over a certain number. We're going to put you on a statin. That's medicine 2.0. And again, if I'm in a car accident, knock on wood, God forbid, whoever you believe in, like I don't want to be in a car accident. But yeah, I'd be grateful that the ambulance shows up, that they're taking me to the hospital, that there is this medical system that can fix my leg or put my lung back in place or whatever needs to happen. Medicine 3.0 is the piece we're starting to see a bit here, hopefully, of, okay, I'm a medical doctor, or I'm a doctor of physical therapy. I'm a primary care physical therapist. That's a whole nother conversation. But my friend in New York City, in Manhattan, she's 40 pounds overweight. I'm like, you got to go see my buddy, David Corona. And that's medicine 3.0 of, we're not going to put you on medication. We're going to hopefully avoid the medication. We have to start building this nutrition plan. Yeah. We have to start talking about your stress. We have to start getting you moving the right way without overdoing it. Again, she might actually watch this, so I'm not calling out any names or whatever, but this is a particular client I have. I'm working on nutrition stuff with her. She was going to see a personal trainer friend of hers. I forget if he was a relative. I apologize if he was her cousin or whatever, but he was charging like $25 a session, which is pretty low. And there's the concept of like, you get what you pay for a little bit. And ultimately it sounded like he was pushing her further into injury, and he did not know how to work around her current injuries and limitations. And in fact, every session made her worse. So that's what David's talking about a little bit here, what we see online when there's no accountability. So these are all big concepts, big conversations, but coming back to it, that's the medicine 2.0 versus medicine 3.0. I think, again, a lot of people it's easy to go to these passive modalities if you're in pain. Like I always say this, like, I don't blame you for seeking out the thing that's going to make your back pain go away and allow you to pick your baby up and allow you to do the thing you want to do.
But wait a minute. I agree with you on that point. The point that I think you and I are stressing here is you're going every week and you're getting back in pain by Wednesday and your appointment's on Friday and you do it every week and you're doing nothing else. This isn't going to fix you, bro. I mean, when it's all said and done, Bo, this doesn't fix you. The reality is we want to heal ourselves and get us to a place where you get a massage and that massage actually stays with you and you feel better and it's great and you don't need it every week. But people are going in thinking it's going to fix them. And I think that's the misnomer. Maybe that's the information, the way the information is being passed along. But there has to be something added on to the passive modality.
Right. But that's the piece too, where again, I would love to just say, hey, what you need to do is find a personal trainer and that'll fix all your problems. Where the truth is, like we've talked about what's wrong with personal trainers, and we can't say, hey, go see your local fitness forward physical therapist. If they use that term, they probably know what's up, and they're the ones who are going to get you out of back pain for the rest of your life.
True.
Like we can't say that. So that's the part where I think there's the huge gap. And again, the passive modality practitioner certainly not incentivized to say, hey, I want to find a way to get you out of pain for that forever. Because if you're in pain forever and you come to see me once a week, I have a consistent client. So whatever that is, let's go with the number $100 a massage, whatever that is. Like or whatever the treatment is. So that's the part where I hear you, and I'm all. And again, this is why we're having these conversations and trying to educate folks. Is there are no easy answers. Like my easy answer is find someone who does an annual movement screen. So if you're active right now, if you're not in pain, right, you need someone to look you up and down and say, okay, let me see how you squat. Let me see how you lunge. Let me see how you do a push-up. Let me see how you do a pull-up, whatever those things are, a ring row. And say, okay, I'm noticing this, this, and this. We're not here to say, oh my God, your hips are off and out of whack, and we have to do. That's what a lot of, again, not to call out our friends, the chiropractors, but a lot of times, a lot of those business models are, okay, we did a scan, and your T7 is, and you showed in red, and it's scary, and it's like, this is off, and only I can pop it back in, or your rib is out of place, and only I can pop it back in. Let me just do that for you. And they might even be able to do something, and it's creating a temporary impact where people buy in. So again, we're not trying to throw a whole industry under the bus, but we're trying to educate the consumer who might be in pain or currently not in pain, or when you are in pain, we hope you have better tools. But that's the part where, again, there's no easy fixes. I have developed my whole system over these years, doctor of physical therapy, CSCS, fitness, personal training, all over the world, Dubai, blah, blah, blah. I'm not here to just talk about my resume, but it's okay. If I have you in front of me, I'm going to do this assessment, again, head to toe. Where are you at? Let me see how you move. These are the things. If we can build this strength, we have that model, again, that spectrum between disease, disability, and fitness and wellness in the center. Right now, let's say you're well. That's great. You're in the center of that. You don't have pain. You're not necessarily as fit as we want. Let's start moving you into fitness, whatever your age is. I just turned 40. I'm doing a half Ironman in a month, I think. I don't even have a bike right now. That's not a good thing. But the point being that, yeah, my goal is to get as far into that fitness as possible without jeopardizing my relationship with my wife, my child, my dog. So it's all a balance of that. So that's the part where we need to be able to simplify for folks, but there's no easy answer. It's not go do the TB12. Freaking hate Tom Brady. Go do the TB12 system. It's not that. It's not go do Soul Cycle, go do CrossFit. There is no easy answer. It's got to be a movement practice. It's got to be educating the consumer. And again, most people are busy, right? It's not that they don't want to do the work. That's where I would a lot of my whatever. I want to fight you on that one. Of course, if there was a pill that we could take that would duplicate the results of exercise, I would take that pill. Of course. Who wouldn't? So you could do all this other stuff. I love exercising for the most part. I hate running. You got to learn to start enjoying it or whatever. But at the end of the day, it's you got to figure out how to do it. And there is no pill. We can't wait for the pill to happen. If there was a pill, though, I think, of course, I would take that pill.
No. By the way, and to back up your sentiment, Ozempic is what, $1,500 a month? People think that's the answer. They're taking it. They're buying it. They're going crazy. It's going nuts. It is what it is. I'm just going to say this to you. I think it's very, very easy to say everybody's busy. I just do. I know you're very busy. We talked to Kenny. If you remember, we talked to Kenny from Arcadium, and he said he had to create time. He had to find time to create time. And I think if you're a parent or you're somebody, I'm 55 years old, man, I don't know many 55-year-olds who aren't in pain. You know what I mean? I know that, but they're not doing anything. I don't have any time. Okay, but you're going to have time when you're sick and you're injured and you have to go see a doctor and you decide to get a surgery. I have a friend of mine, a dear friend of mine that I went to school with, who's going to get a hip replacement. And I'm looking at him. I said to him, "You're going to get the hip replacement?" He said, "Yeah." And he goes, "The massage doesn't work anymore." I said, "Dude, you're 360 pounds. You used to weigh 220. You need to lose weight. You need to strengthen your body up. You may not need that surgery." And what I'm kind of seeing, and I'm not sure if it's the medical community per se, But what I'm kind of saying is the easy way out in a lot of situations. And some people think that surgery is the easy way out. And what they don't understand is in the end, that surgery is the harder route. Because if you don't do the rehab appropriately, you're going to come out a mess.
Well, the only
Or
thing I
come
want to
out
interject
a
there,
different.
I'm gonna defend your friend there, the client, to say, I imagine in every single one of those situations, he has tried Weight Watchers, he has tried the keto diet, he has tried intermittent fasting, he has tried what was in front of him,
Correct.
and again, and you're like, well, but there's this amazing thing over here, no one's ever told you about it, and I know about it, and again, yes, that's the thing, that's the disconnect. But your thing, unfortunately, is not as easy to market. The right answer is it's not as sexy. It's not as easy to market. And it takes time. And again, the results, that's the other part too. When I work with people on nutrition, I'm like, hey, I need you to sign up for a year. Because even if we, because there's easy ways to get you 6-pack abs in 6 days or 6 weeks or whatever, 6-minute abs. And what if they come up with 5-minute abs? But and again, so that's the part where I want to push back on you, and just in general, this whole thing again, it's easy to say, hey, but you got to do the work. And again, these folks, I know, I've had these clients. I know you know this as well. I think it's easy to overlook that part though, because we're talking about Ozempic sexy. Yeah, I know you know that, but I just want to make sure that's in that conversation. And unfortunately, it dilutes the message. But I just want to make sure that that's clear, that people don't feel like he's calling me lazy. And again, there's all these people, there's these CEOs and they're unhealthy, and they're clearly not lazy because they're busting their butt on that. It's about priorities, it's about values, it's about time, it's about knowledge of, oh, I know so-and-so did this and they're healthy, and Dana White, we were just talking about that before offline. Dana White did this thing and intermittent fasted for this, and he did the water diet, and look at, he lost 60 pounds and he looks great. And he's got a 6-pack. And again, we've talked about this 1,000 times, is like, unless you're J-Lo, unless you have her resources or genetics or money or Dana White's resources, like it's not likely going to be the same results for you. And a lot of times when those things are public like that, we're not getting the whole picture also of what other things is he taking. Maybe he's taking Ozempic and maybe he just didn't mention that, or maybe he's taking performance enhancing drugs, other ones. Anyway.
No, but I just want to get to the point where, listen, part of our whole thing is, and I say this all the time, that we heal ourselves. And I'm not saying everybody's lazy, the world's lazy, and I'm not. That's not what I'm saying. What I'm getting at is that, and I've dealt this with clientele in my past, where they get a massage for something instead of doing the work. Or I feel much better when I get the massage. Every time I work with you, it's uncomfortable. We're trying to break things up. We're trying to get you to do things that your body doesn't normally do. It's not going to be a straight line. It's going to go like this. That's just the way that goes. And I don't want anybody to get this twisted, that I think that, just fix it. It's not that easy. I don't know your lifestyle. I don't know you as a human being. I don't know any of that. But I do know that if you do carve some time out for yourself, and you do these passive modalities can be much more effective for you if you're doing the other work, which is setting yourself up on a different path. In other words, lifting weights. Opposite, you see these muscles are tight. Let me get these muscles are weak. Let me strengthen these muscles. Let's stretch those muscles.
Let's put a name on that. A well-designed, an evidence-based
movement practice.
I don't know, movement practice or fitness routine or weight lifting, because that's almost always part of it. Like, so I don't know the exact words. We don't have that in front of us right now. And that's the thing. But we need to have closer to, that's the ideal.
Yes.
And again, the further people are from that, that's the problem. If that piece is missing, because again, we talked about the analogy to the blood work that you might do with your doctor. And he's like, hey, you're deficient in this, this, and this. We're going to put you on this, this, and this medication. Here we're talking about, okay, you can do these supplements, meaning massage, dry needling, acupuncture, chiropractic, whatever that is. Those are supplements. They need to be supplements. If they're the primary meals you're having, if all you're eating for breakfast is 17 pills, I think we can all see that's not ideal, even if that's giving you a lot of the nutrition that like theoretically on paper is good. No, we have a relationship with food, just like we have a relationship with movement. So if you're not moving, if you're not getting your hands on the floor, and yes, everyone hates burpees, I know, but like if you're not getting up and down off the floor, some point, especially as you get older and you've lost that ability to get up and down off the floor, that's a problem. Like yoga might get you up and down off the floor. Pilates might get you up and down off the floor. But then I had one of my neighbors here, a 70-year-old woman, osteoporotic. It's like, well, I'm doing yoga and pickleball. Why are my bones not strong? Why are my bones loose? Because pickleball and yoga pickleball and yoga are deficient in stimulating bone growth. So that's where muscle is the organ of longevity. What we should be doing, and to kind of make this again a part of the whole conversation, if we're not prioritizing, we said what's missing is people don't prioritize what they need to prioritize, but the message is not out there. People say overweight. Hey, you're overweight. You need to lose 40 pounds. Ozempic tends to make people, and this is the big knock on it, lose a lot of muscle mass. So they might lose 40 pounds. Yes. 20 of those pounds might be muscle mass. So that's a problem in the long term, right? So we talk about that. One of our favorite sayings here is muscle is the organ of longevity. So again, modalities need to be just that. Just like a supplement needs to be just that. If I'm taking a vitamin D3 supplement, right, it needs to be because I didn't have enough sunshine this week. I didn't have time to go outside and have my morning coffee and take in 20 minutes of wonderful sunrise with a book and my gratitude journal. And like, that's all good. But most people don't have time for that. Like, and so because I don't have time for that, even though I'm in Colorado here, and if I'm in a clinic for 10 hours a day treating patients, like I might pop out and get a little sunshine. But if I don't have time for that because I'm so busy, I'm catching up on paperwork, I have to take a vitamin D3 supplement, whatever that is, once a week, a couple times a week, taking fish oil supplements because I don't have time for that. So again, that's where passive modalities need to fit in because I don't have enough time to do the yoga, the Pilates, the stretching, the bow flow that I put out there, 6 minutes.
So sure, the bow flow. But I'm gonna say this to you. You like I do, and I'm busy. I prioritize myself. I take care of myself every morning at 5 a.m. I'm in the gym by 5. I do my work. I do it because I want to be able to be the best I can be in my given day for my people. And the reality of it is, I just think, obviously, I don't have children. I'm not married. I live with a wonderful woman, Abby. She's the best. But when it's all boiled down to this, I just think we need to create a better way. Now, I will agree with you 1,000% that what we're talking about isn't talked about enough so that people can get a better understanding about what we're doing. And that's why we have the podcast. That way we have it. The reality is everybody's out there selling some. We're giving you information to make you better. And I think when it's all said and done, when it comes to these passive modalities and all these other stuff, there's another side to this that needs to be really, really attached. And there's another side of it. I'm not going to tell you every trainer is good because I don't agree. I don't believe in that. But when we've given you the information, I believe it was episode 1 about how to go find a trainer. We've done it again in, like, I think it was episode 15. Well, we've done it in year 2. There's ways to go about this, and we're trying. And by the way, if you are looking, let me see my desk here. We have episode 1 was about trainers. We also have episode season 2. It's in season 2. I can't find it right now, but it's in season 2. But we have done 2 podcasts on this stuff on how to go out and find a professional. We've done it for physical therapists. We've done it for trainers. And now we're here. And these passive modalities, again, nobody's bashing them. But that they alone are not sufficient. Period. Full stop.
Yeah, and just to make it even simpler, again, like we said, we use these passive modalities, right? Like I love getting a massage. I have a new person who contacted me and was like, hey, like, I don't know that I can afford you. I'm a massage therapist. I'm like, doing whatever. Like, would you be open to a trade? Like, absolutely. I will take your massage for my, like we can talk about your pay rate versus my pay rate, all that kind of stuff. But I'm like, yes, again, massage is a wonderful thing. But how does it fit in? Another one we didn't talk about, Stretch Lab. There's these stretch zones, these places you go and get stretched out. Because, and like, again, what is that? You're paying money for something. You can pull up a YouTube video Like, again, I have my Bowflows, but you can go on YouTube and say, give me a, 30-minute stretching session.
Go to Bowflow.
Go to Bowflow, but wherever you can go, it's easy. It's free. You can do that, but they'd rather pay someone money to lay down on a table, and they're going to stretch them out for them. Like, okay, breathe into this, and it's a whole thing. So that's the world we're living in, and that's okay. We're not judging people for doing that. I think it's important to understand the people, why they're choosing that path. I think it's because there is no simple solution. We're talking about a complex solution. The right solution is a more complex solution. I think the other piece, that when you said you wake up at 5 a.m. so you can do your thing and get ready for your day and your people and do your thing, that's your identity. I think that's the part where most people don't have their identity connected yet. I think that's where most personal trainers fail, is they're not saying, hey, are you committed to this? Is this who you're going to be? Are you going to be here every morning at 5 a.m. or whatever? Are you going to pay this much money if it's feasible, whatever the thing is? But you need to change your identity. For a lot of people, you mentioned the guy over 300 pounds, like his identity was probably for a long time, I'm the guy who's always on a diet. And then that diet doesn't work. And so I try another diet, and this diet's too frustrating. So they're the dieting. That's their identity. That's not the same as a healthy person. It's like you have to be able to change the identity. I want to be a healthy person. So it's you dress for the job you want, right? It's like you have to start making the choices and behaviors for the person you want to be. So if you want to be healthy for your kids, that's the other little meme going around, right? Like, you would do anything for your kids. You jump in front of a car for your kids. You take a bullet for your kids. But would you get healthy for your kids? Like, and again, I don't mean to belittle that concept, but that's the part where, like, again, everybody would love to be healthy. Everyone's like, hey, should I do yoga? Should I do Pilates? I'm like, they're all good. And if there was a simple thing, if it's like yoga's the thing that's going to fix you, I feel like I've said this 3,000 times. I don't even know if it's on this podcast, my podcast, and talking to patients, clients, all this thing. But like, if there was any one thing that would fix you, let's do it. I'm all in. CrossFit always kind of said that too. Like, if Zumba made you more fit based on this definition of fitness, then let's all do Zumba. But it doesn't seem to do that. And so again, these conversations are definitely more nuanced. That's why we already talked almost 40 something minutes, so it's complicated, but that's the part. Identity is often missing in these conversations where it's like, we're looking for the answers. We're looking, and again, I go to the chiropractor cracks my back. I feel better. That back pain went away. I feel like he told me my hips are out of alignment and that he popped my hips back in alignment. And now I feel better. Like, why would I not believe that, even though scientifically there's zero support of what that is? Like, posture is a whole complex thing, right? Ribs being out is a whole, like, we can go into the depth of that. But the point being, we're all looking for easy solutions. I would 100% take a pill if it got me to the solution and, I wanted to get to. But there is no pill. It's not coming. So we gotta find the right solutions. I'm okay, committing to doing 1,000,000 meters of rowing this year because I know that's going to help my fitness. And sometimes it's hard for me to find 10 minutes to jump on the rower and get my, 2,000 meters in every day that I got to do, and then some. But
you had a full recalibrate. You had a full recalibration with a child coming into your life, which changes a whole lot. But so let's not. I mean, because we've kind of really touched this whole thing. Let's wrap this up. And let's give the consumer the answer, not the answer, but let's give them a little guide, a little roadmap to what they should be looking for going. We're
going to see you guys on the next episode. We'll give you the answer on the next episode. No,
later. And by the way, cheaper is not better all the time. Go ahead.
No. So we're wrapping it up.
Two things.
I think that's the piece. Is it's easy to say, I have this neck pain. I woke up with this neck pain. I think it's because of stress, and I'm just in a stressful period of my life. But I need you to get me out of this neck pain. Like, I need it to be gone tomorrow. It's easy to go through that, as my friend is going through right now. It's much harder to understand root cause medicine. And what is the root? Why did that develop? Why is it on your left side and not your right side? Why is it causing tingling into your fingers? Those are things that I say we need to address this, because if we don't, and again, maybe it's how you're working out. Maybe it is how you're holding your child. Maybe it is, again, an imbalance of muscles and things like that. So annual movement screen is my biggest thing. That find a practitioner, whether it's a personal trainer, whether it's a doctor of physical therapy, a fitness forward doctor of physical therapy. There's many other practitioners who can probably do this, but hey, I heard about this thing on this podcast. Could you look at me head to toe and tell me where I'm not moving well? Is that something you do? Like, would you do that for me? How much do I have to pay you? And that's the other part that we kind of skipped over on a lot of this is, again, you think about how much a massage costs, how much an acupuncturist costs. If I said, hey, work with me for 12 weeks and pay me $10,000 or $20,000, and there's people who sell these packages, by the way. The whole Dana White thing, I'm sure he paid his guy $1 million to get him. And he's like, you got 6 months to make me the healthiest person ever. And they got the results they needed to. Whatever. Russell Wilson, LeBron James. Russell Wilson's a terrible example now, but he was always one of the guys who spent over $1 million on his body a year. Now, again, there's a whole different conversation to a professional athlete. But yeah, that's the point. If you look at how much you would spend with a practitioner, that's an investment. And I don't think, again, most people are identifying that as, hey, help me get better. And whatever you tell me I'm going to do, or let's go back and forth on troubleshoot this. You're my coach, so I won't always be able to make the shot the way you want me to make it. Oh, keep your elbow in when you're doing the thing, or throw the ball, make sure your hips are pointing toward your target that you want to throw to. Like, a coach can tell you these things. A coach like Corona can tell you, a personal trainer like Corona can tell you, hey, I need you to do these, do 100 push-ups a day, or whatever the simple thing is, or complicated thing is, but the point is, it's going to come back to the person doing the work. So that's the piece. If there's a gap there, if you're just going and getting the massage and you feel better, if that's a good thing for you, okay, like I can tell you that's wrong, but I understand why people do it. But again, we're saying, hey, if that practitioner is putting needles in you or whatever, and there's no follow-up conversation of make sure you do this, this, and this to hone in that change I just made with the needles or the chiropractic adjustment or whatever. If there's a lack of game plan, right? If it's just, I need you to come see me twice a week for the next 10 weeks, and then we'll get you all fixed up. That's not a solution. That's not root cause medicine. It might make you feel better, but most things, I think you said it somewhere in here, and it's one of these things, again, the Huberman piece about low back pain, most orthopedic issues, most pain will go away on its own, or your body will heal itself. You'll find a way to adjust within 6 weeks. Sometimes it takes longer. For some people, they run out of patience. Again, it's the 7th time this has happened in the last 5 years, so it's more frustrating. So that's the part where don't let it get to that. Listen to the whispers before they become yells. Find somebody to be your doctor of movement. That's the part where I think, again, we need to, that's my platform I'm running on in 2024 here is for office is you need someone in your corner to coach you to move better. You probably have that for your blood work. You probably have that for your car. Again, these analogies we've used. So that's the big takeaway is if somebody's just helping you feel better, great. But you need to understand that is not the final thing. Right? You need to have someone look at your blood work. You need to have someone look at your cholesterol and be able to say your risk factor for a cardiac event is this. And based on that, here are our options. We can do surgery. We can put you on medication. We can change your lifestyle. And if that lifestyle piece is not in the conversation, then maybe that's not the person for you. Maybe they acknowledge that, hey, it's too late to change your lifestyle. We need to cut you open. You have 70% blockage in your arteries, whatever. Anyway, that's my big platform is you need someone to help you with your movements because that's what you're doing every day. That's why the first thing I talk about with almost everybody is breathing, right? Because breathing is something you can control. And 98% of people breathe incorrectly. If you go to any of my platforms, my social media, my Instagram, my TikTok, whatever, I probably have something in the last few weeks about breathing because everybody does it wrong. Everybody could do it better. It takes a lot of practice and concentration to breathe better, but that's something you can control. And again, selling the thing that people can control is not sexy. I don't expect to be a millionaire anytime soon. I know there are ways to do it with marketing and sleazy. I don't want to call it sleaziness, but I can sell more skin. I can show more stuff, but that's not necessarily what we're here for. So anyway, what are your takeaways?
Mine's simple. Hold on one second, man. Close this up. Close it up for me, Bo. Close the show up for me. I got to do something real quick.
Okay, so we're gonna sign off there. I just ranted and raved for a while. We can call it right there, guys. So, Corona did not mute himself. I'll mute him. So technical difficulties at the end there, folks. He also wasn't feeling well today. So thank you, David, for jumping on. So I'm going to wrap it up here. A little under an hour. Again, if you want to get a virtual movement screen, I'm going to sell that right now. And again, I hate selling things, but that's kind of what we're talking about. That's why we're here. Find someone who does. There's plenty of people who can hopefully give you a high level, head to toe assessment to give you an understanding of where you're at. Don't wait for yourself to pop an Achilles or to dislocate your shoulder or what have you. If you're not doing the basics, you're going to continue to see these issues. You might be able to compensate and work around this stuff for a long time. But I personally prefer to avoid injuries. I personally prefer, is David going to join us for this wrap up? Are you wrapping us up with this? No? Are you done? Are you back? No, he's putting on his headphones.
I'm back.
I'm going to wrap it up here unless.
I'll wrap it up for you right now.
All right.
Yeah, I'm going to close it up here. Thank you, listeners, for joining us today. We're truly grateful for your presence and support. If you enjoyed today's episode and found value in our conversation, we kindly ask you for your support. Help us spread the word about the Demand Better podcast by writing a review, liking, sharing, or subscribing to our show. Your engagement means the world to us and help us reach more individuals who are seeking to demand better in their lives. Remember, together we can make a difference to strive for a better tomorrow. Stay tuned for more thought-provoking discussions and inspiring guests in the upcoming episode. We're sponsored by Fit Care Physiotherapy and Wellness, with the emphasis to focus on your fitness so you can avoid the healthcare space. Thank you once again, and until next time, keep demanding better. Peace.
Peace.